Hello, my name is Dr. Mark Socinski, and I'm the Executive Medical Director of the Advent Health Cancer Institute in Orlando, Florida. NTRK positive non-small cell lung cancer occurs in a very small percentage of patients. I would call it in the kind of rare to uncommon mutation. This would clearly be 1% or less of patients, but it does occur. Of course, NTRK fusions occur across a broad spectrum of sarcomas and other cancers, some pediatric conditions and these sorts of things. It is important that it be included in a comprehensive genomic testing profile, because you will find it in a small percentage of the patients with non-small cell lung cancer. And again, it's part of the list of genomic alterations in which the FDA has approved therapies for. And those approved therapies really are two drugs. Larotrectinib was the first. This showed very high response rates in the range of 70 to 80% in previously untreated patients with great durability. And the second drug, entrectinib, again occurs in or has about a response rate of about 60% at least in the trials in which it was presented. So overall, these are very active agents in the treatment of NTRK disease. And again, this high level of activity can only be given to your patient if you do the proper testing to look for NTRK fusions. Now, with regard to the safety profile, these are generally pretty well tolerated agents. The one issue is that there are some neurologic side effects that can occur both with entrectinib and larotrectinib. These include impairments in memory and some learning difficulties, these sorts of things, some defect in proprioception and these sorts of things. Also, some peripheral neuropathy issues have been described, so it's important to be aware of this. But really, other than that, some minor cardiac issues, but other than that, really a pretty well-tolerated agents, particularly when you compare it to the response rates that have been seen in this particular setting. So again, NTRK is one of those things that you will uncommonly to rarely see in advanced non-small cell lung cancer. However, when you do see it, there's two great options. Both larotrectinib and entrectinib also have very good CNS penetration. So that's another advantage of these two oral TKIs. And certainly this would be my go-to first-line treatment in those patients who are found to have an NTRK fusion at the time of initial diagnosis. It's important to note that the dose reductions occur in about a quarter of the patients with entrectinib, but only about 10% with larotrectinib, and treatment discontinuation, less than 5% of patients had to discontinue the drug due to some reason. And so it speaks to the tolerability of these oral agents in the setting of NTRK fusion positive non-small cell lung cancer.